Good evening, and thank you for being here with us as we get an update on COVID-19 management and strategies and more from the Department of Public Health. I am Natalie Allen from the Department of Communications and Community Engagement, and I am here with Dr. Spence, our superintendent, Jack Freeman, our Chief Operations Officer, and Dr. Caitlin Padati, the new District Director at the Virginia Beach Department of Public Health. Dr. Padati, can you take a moment to tell us a little bit about your background?
Absolutely. Thank you so much. So I am your new director for the Virginia Beach Department of Public Health. So I actually grew up in the Northern Virginia area and went to school in DC at Georgetown and then George Washington. And that's where I got my medical degree. And also I got a master's degree in public health, focusing in particular on epidemiology. So that's those patterns of disease and health in populations. So from there, I found that I really loved working with kids. And so I went on and trained as a general pediatrician at DC Children's and really enjoyed it there, learned a lot, and really wanted to continue to have an impact on kids' health, but really population health on a bigger level. And so I was actually able to join the CDC, where I worked for several years as what we call an epidemic intelligence service officer. So really providing support for the CDC and for the state of Nebraska, where I was assigned on a wide variety of health issues. And I enjoyed that work, especially the public health work at the state level. So I worked directly for both the states of Nebraska and then Iowa for some time as the medical director and state epidemiologist. And so I've really enjoyed functioning in public health at both the federal and state levels. And of course, using my background as a doctor to help serve that role. But I'm very excited to be now back in my home state of Virginia and here in Virginia Beach, able to serve the city here.
Thank you so much, and we're so happy to have you. It's been great to work with you thus far. We will now see a short presentation from Dr. Padati where she plans to go over some of the new guidance, and we'll answer some of the questions that were sent out or sent in, excuse me, from our families ahead of time. Dr. Padati, the floor is yours.
Thank you so much. So what I thought I might do is first start by saying thank you to all of you for joining for this conversation tonight. It's so great to have the opportunity to talk through what's going on in public health. And I know it's been a very challenging couple of years with a lot that changes very quickly. And so opportunities like this are so important. And I really appreciate everybody for all the things that you do to help keep our community healthy. So what we've got here for the objectives are, I want to describe just a little bit of our current data. So what the situation looks like right now. I want to talk with you a little bit about the public health approach and how we're making some updates, and then just give a quick reminder on the best practices and recommendations that we have for public health. So what you're seeing here is what we like to call an epi curve or epidemic curve. And I'm sure you have seen many of these over the past couple of years for different areas. This is the epi curve for COVID-19 activity here in Virginia Beach. And epidemiologists, we love to look at data this way because it characterizes it by place and time. And so it really gives you a good sense of the patterns. So if you look at this, what you can see is early on back in 2020 of March, when we identified our first cases, we started to see those cases come in smaller numbers. And that was a time where it was really, really important that we did things like staying home and really understanding all of the activities, places people had been, where this virus was active, because there were small numbers and we were able to help investigate those situations. So you'll remember then that we started to see that increase that occurred sort of, towards the summertime, but then a much bigger increase that happened in the winter holiday time of December 2020 and January 21. And in some ways, that is similar to what we see for other respiratory viruses. So this is certainly not the same as other respiratory viruses, but there are some viruses that we can learn from because of their patterns, and flu is a great example of this. So when we get together in the holidays, we travel, we gather in groups tightly indoors, we create these opportunities for viruses to spread from one person to another. And unfortunately, COVID can do that, right? So we did see that increase, but around that time, we also started to get vaccines, which was just incredible. So, the development of these vaccines that work really well to keep us out of the hospital, keep us from having bad outcomes, from possibly dying, they work so well, and we were able to come together and develop them in a really big way that really is such a great scientific achievement. So what you can see on this curve is as those vaccines start becoming available for adults, but also for our kids, we started to see some of that activity come down. So all the while, we're gaining new tools in public health for how we can fight this virus, right? So the most important one is vaccine, but we're also gaining things like medicines, and our healthcare providers, our doctors are learning how to take care of patients with this virus. So we're getting a little better at managing it. We're developing new tools. At the same time, though, the virus is sort of changing, right? So viruses do this. All viruses, when they replicate, they can make little mistakes from time to time. Those mistakes can lead to the development of new strains. And again, we see this very often with things like flu, right? We talk about new strains of flu every year. So this is something that COVID did too. It changed over time. And you can see that happening with the Delta variant that occurred over the summer. And then you see it happen again, right? Most recently with Omicron. So that's the latest dominant circulating strain of COVID-19. And so, what's happening in particular with this curve, you can see that increase is much bigger and much steeper than the other increases that we had. And that tells us a couple of things, right? It tells us that this is more transmissible, so it moves between us more easily. It also tells us that the incubation period, or the time it takes from when I get exposed to when I get sick, is much shorter than the other strains were. These are all reasons why, as we look at this, it's time for us to start to think about how can we make the best use of the public health tools we have to help continue to fight this virus. So again, remember, going back to December of 2019, this was a brand new virus. We didn't know anything about it. Everybody was susceptible to it, and we didn't have a lot of tools to fight it. Now, since then, we've learned a lot more, right? So we understand better about how the virus moves between us. We understand more about the symptoms, and also who among us are the people who could be most poorly affected. So people who will have serious illness, get really sick, might have to go to the hospital or die. And that group, again, is our people with underlying conditions or people who are older. So all the while, again, we gained some really important tools that we didn't have at the beginning. So vaccines, which are just incredible, good medicines, things like testing, all of these tools that are helping us to bring down virus activity. And then again, in addition to that, while we were doing all this work, the virus was sort of changing too, from its original sort of behavior to what we see now with Omicron. And again, this is why it's time for us to sort of take a look at what are our approaches and how can we be most effective. So we think about the new tools we have in our toolbox, and that again includes all of the new knowledge we have, understanding who's most affected, and combining that with all of our resources. And again, vaccine is going to be the #1 resource that we have now that we didn't have then. And we add to that things like medicines, masks, testing, which includes at-home tests, and just really widespread and widely available information, which is great. So I want to talk a little bit about contact tracing. So contact tracing is a really important public health tool. We've used it for a long time, and it serves a couple of purposes. When we do contact tracing, what we're trying to do is advise people about what they can do to stay healthy if they've been exposed to an illness. And then we're also trying to understand a little bit about where somebody might have gotten it so that we can help implement control measures. So for example, sometimes we use this kind of tool with like a salad that might have been infected with E. coli, right? We're trying to get back to where we think something might have happened to see if there's something we need to do to change the exposure. So this is a great tool. It works really well. We use it a lot for things like Ebola. We also use it for things to target outbreaks of diseases for certain groups, because again, it helps us understand what might be going on for sort of an acute outbreak or group setting. It's not actually a tool that we use for other respiratory viruses, so things like flu. Now, keep in mind, flu is not the same as COVID. There are a lot of reasons why they're very different diseases, but for public health, flu actually offers a lot of good framework and lessons learned about the tools that we have in place and the things that we can do to address those kinds of viruses. Particularly early on with COVID-19, we didn't have other tools. And so contact tracing and case investigation was a really important tool that we needed while we worked to develop things like vaccines and medicines. So again, as we've developed those tools, and as the virus has been changing and starting to become more endemic, so by that I mean a part of circulating illnesses that we see in the community, like flu, those are the reasons why it's time for us to take a look at, okay, well, what are the ways we can be most effective with our public health resources? So again, in the beginning, it was really important for us to understand every case and to follow up on that. And we've seen some changes, which include now with the Omicron strain, a really large number of cases all at once, right? It also includes asymptomatic and mild cases. We also have seen the increase in availability of different kinds of testing, which is wonderful. And that includes things like at-home tests. But it means that all of those test results might not always be made known to public health, right? So sort of like if you took a pregnancy test at home, that's not necessarily a test result that your doctor would always see. And so all of the tests that can happen at home, they're great because they help increase convenience and they help us make decisions about our health, but they're not always things that get reported over to public health. We've also seen that shorter incubation period and that increased transmission with Omicron. So that means that it's taking less time for that virus to move between us. And so when the information comes to public health, it's possible that people have already done the things they need to do, which is great. So what we want to do now is think about how we can best focus public health tools, including contact tracing and case investigation. So that means we're going to start to really focus in on things like clusters, so groups of people who are sick all in the same time at the same space or location. Thinking about outbreaks in our high risk settings, so places like congregate care settings, long-term care facilities, places where we have people who might be more vulnerable for bad outcomes. And we also, of course, are going to continue to work very closely with our school partners because we want to make sure we're offering all the tools and strategies that we can to help bring virus activity down and keep our kids safe and in school. So just like we do for other diseases, public health is going to continue to use those case investigation and contact tracing tools and focus them on those vulnerable areas and outbreak kind of situations. So there will be situations where we're going to continue to be reaching out to people and asking for information to help us understand what's going on and understand what other types of recommendations we can make to help bring virus activity down. And we're always incredibly grateful for the time that people offer us when we call to have those conversations and get that information. So we're also really glad that at this point, most people are much more familiar with COVID than they were years ago. And so people are more familiar with the things we need to do. And so that's including things like getting vaccinated, wearing masks, and staying home when you're sick. So we want to remind everybody, we continue to encourage everyone, we want you to isolate. So stay home when you're sick with COVID. And really, we want you to stay home when you're not feeling well for any reason, right? Because if you're sick and you could potentially get somebody else sick, the way to help limit that spread, whether it's COVID or flu or norovirus, right, is to avoid being around other people. We also want to encourage people to let people who you've been in close contact with know that you were sick, that you had COVID, right? So that they can then make sure that if they need to, they can get tested, or if they're not feeling well, they'll also stay home. Because everything we do to help reduce those chances for the virus to move between us brings that activity down overall. And then, of course, we still recommend that people quarantine, and that means you've been exposed, but you still feel well. So we want you to stay home in that case if you've been identified as a close contact of somebody who has COVID and you're not quite up to date on your vaccines. So finally, just a reminder, and I know these are messages that you all have heard in many settings, but they really are really important. And these are going to be our public health keys to helping to bring down virus activity, starting with getting vaccinated, wearing masks when virus activity is high and we're in those group settings, and staying home when we're sick. And I think with that, I can turn it back to you, Natalie.
Thank you so much, Dr. Padati. That was extremely informative. We really appreciate that presentation. And now we're going to get into our question and answer part. We had a lot of our families send in questions ahead of time, and we have our lovely panelists here to answer them for you. And, not to give you too long of a break, Dr. Padati, we're going to throw it right back to you.
That's great.
So first question, how long after a child has COVID do you have to wait until they can get vaccinated?
Yep. So if a child's been sick with COVID, they can get vaccinated after they've finished that 10-day isolation period. So we want to make sure that you've made it 10 days, that you haven't had a fever, and that your symptoms have been improving for at least 24 hours. And we say that for a couple of reasons. We want to make sure that the child who wants to get vaccinated is feeling better, and also it helps reduce the spread of the virus.
Great, thank you. And you talked a little bit about this in your presentation, but can you go a little bit more in depth about what the plan is going forward with contact tracing in the school division?
Absolutely. It's an important question. So remember, contact tracing hasn't stopped. What we're doing is refocusing that public health tool in the places where we think we can be most effective. So again, it's a strategy that we use when we don't have a lot of other tools and when we're trying to really focus in on what might be going on for a particular group or for a particular setting. And that's what we're going to continue to do. So we're still going to be reaching out to people, trying to investigate things like clusters and outbreaks among our most vulnerable populations. So as the virus gets a little bit more endemic, right? Again, that means it's starting to become a little bit more a part of what circulates in our communities. Unfortunately, it's been around now for a couple of years. It's not as important for us to call every single case to understand where they could have been exposed, because we know that exposure could have happened in a lot of places because virus activity is really happening in a lot of places in the community. And again, while they're not exactly the same, this is a lot of how we think about flu, right? Every year we see flu circulate. We know that we follow flu activity levels in our community. And we don't necessarily always try to get to where somebody could have gotten flu, but we do want to remind people what they can do to keep themselves safe and healthy. And it actually now is very similar. So that's going to mean making sure that you get vaccinated to help prevent yourself from getting infected, making sure that we do things like wash our hands, stay home when we're sick, and use tools like masking when there's a lot of increased virus activity and we're indoors. So just like we always do, public health is going to continue to evaluate virus activity and then how we can make the best use of the tools that we have. And so if we continue to see things change, we may need to adjust our approach again. But right now, we're really wanting to focus the particular public health tool of contact tracing on those outbreak settings and vulnerable populations where it can be most impactful.
Great, thank you. And this next question kind of piggybacks on that too. How much longer do you anticipate having to use things like quarantine and continue using COVID mitigation strategies in the school division?
It's a great question. So when we talk about mitigation, right, what we're talking about are all the things that we do to help bring down risk of getting infected. And remember, that's really what we're trying to do is lower the risk of getting infected. So you can kind of think about the mitigation strategies similar to the way that we might lower risk of getting in a car accident, right? So if we think about what we do in a car situation, we have a variety of things that help protect us from dying in a car crash. We've got things like brakes, we've got seatbelts, we've got airbags, even the structure of the car, right? All of these things can be layered together to help keep us safe in the event of a car crash. Now, similarly, if we're trying to lower risk and keep ourselves safe from COVID, there's a variety of things that we can layer together to help bring that risk down. So that really begins with prevention, which is vaccine. And so getting vaccinated and boosted or being up to date on your vaccines is going to be the best way to prevent yourself and your loved ones from getting sick. Then you want to layer on top of that additional things, right? So that includes stuff like frequent hand washing, staying home when we're sick, using social distancing, and using things like masks when we're in crowded indoor settings and virus activity is high. So no, there's not one of those things, right, that's perfect. All of those things have some limitations. Even vaccine has some limitations. We know that there are some people who can get vaccinated and still get infected. We also know that the vaccines are working incredibly well, even for people who still get infected, at keeping them out of the hospital and keeping them from having those bad outcomes and dying. And so what's really important is that we don't rely on any single one of those things. What we do is we layer them together to help keep people safe. And so when we think about how long we want to be using those, as we've talked about before, what we're going to do is take a look at virus activity over time, and we'll adjust those recommendations and how we use those tools depending on what we see happening with virus activity.
And speaking of the layered mitigation strategies, can you talk a little bit more about how we ensure safety of students since masks are no longer required for every student? And I know we've talked about layered mitigation strategies, but I think parents also want to hear what those are. We reference them a lot, but obviously, we kind of talk about that Swiss cheese model, but if you could repeat some of that for our families, that would be wonderful.
Absolutely. So again, when we think about mitigation, we want to bring together all of those things that we can to bring that risk down. So it's not going to be possible to get that risk to zero, but we can add in those things, those tools that we have to help make it less high or lower that risk. And so we really always in public health want to be on the preventive side. So that means we want to get vaccinated so that we teach our immune systems what to do if they were to come up against the virus. So it starts with vaccine. We layer on things like the symptom screener that helps us take stock of how we're feeling, and if we have any symptoms, reminds us not to come into school or to work. Things like using masks, washing our hands, environmental cleaning and surface cleaning, using things like space, so having bigger spaces or outdoor spaces when we can, staying in certain groups together throughout the day, so that idea of cohorting, so staying in a shared group in different activities, and of course, staying home when we're sick. So again, the idea here is that it's not any single one of these things that we rely on completely. What we want to do is add in these tools as much as we can, and we adjust that according to what we see happening with virus activity. And that's sort of the public health perspective.
And so with that as kind of being the broad perspective from the public health side, from a Virginia Beach City Public School side, so obviously leveraging the key elements are vaccination, staying home when you're sick, and we've got a self-screening tool to assist with that, masks and distancing, and those are all key parts of the layered prevention strategy. To support vaccination, it's broadly available, and we're currently hosting clinics. We have a clinic tonight at Woodstock Elementary School, and we continue to partner with Virginia Beach Department of Public Health to offer that access to the vaccine. Masks are still required by Virginia Beach City Public Schools, but EO2, Executive Order 2, authorized parents to opt their students out of masks during the school day. So it's a nuance, but it is an important distinction that Executive Order 2 gave families and parents the ability to opt their kids out of those mask requirements. So with that being the case, we continue to offer procedural masks for those who want to wear them. And we are also have an order placed for KN95 masks for both staff and students. And properly worn KN95 masks offer improved protection for the wearer. So another step that we're trying to make to add additional protection. Distancing, it should occur to the maximum extent practicable. So remember, the goal is to safely get all kids into 5 days of in-person learning. And so we acknowledge that that doesn't happen to 3 or 6 feet, in all cases 3 feet when both students are wearing a mask, or 6 feet when one student is not wearing a mask. But the balance of risk there is to try and get all kids into 5 days of in-person learning. Additional layers, Dr. Padotti talked extensively about the modified contact tracing, and that's combined with isolation and quarantine. And those updated standards are 5 days of isolation and quarantine, followed by 5 days of wearing a mask. We meet daily with Virginia Beach Department of Public Health to analyze our positive cases and absentee rates so that we can determine whether we have an area of elevated risk and whether we need to close down a classroom. For those who are experiencing symptoms, we have at-home test kits that are proctored tests that you can do at home to help quickly determine if student or staff is positive. We cohort where possible, as Dr. Padotti mentioned. She mentioned ventilation. So for our HVAC systems, we have been, since the beginning of the pandemic, paying a lot of attention of how we maintain our systems so that they are delivering the airflow that they are designed to deliver. We also have put portable HEPA filters with UVC capability. So the HEPA filter means it has a high degree of filtration. It can filter very small particles. And the UVC capability means that it can kill bacteria and viruses through those portable HEPA filters. And those are in classrooms, they're in our clinics, and they're in isolation rooms. And we also encourage in open windows. And as Dr. Padotti mentioned, we encourage outdoor activities when the conditions permit. From a cleaning protocol standpoint, we have misters and sprayers that spray disinfectant in all of our classrooms every night. We have disinfectant, paper towels, gloves, hand sanitizer in each of our classrooms that can address spot cleaning on a daily basis. We also sanitize our high-touch surfaces in our buildings throughout the day as well. Last thing that worth noting, so we also conduct screening testing for our unvaccinated high school athletes who are participating in winter athletics and conditioning. So this was intended to reduce the risk associated with indoor athletics during the winter time, which we knew was a high risk activity. And that program will conclude at the end of winter athletics and it'll be discontinued as we move into spring athletics. So I know that was a lot, but I'll turn that back over to you, Natalie.
That was a perfect transition into our next question. And Dr. Spence, we're gonna turn it over to you for this one. Is it possible to only test athletes who are experiencing symptoms in place of the current model?
Yeah, that's a great question. First, let me just thank again everybody who's joined us this evening. We've got a great list, group of participants here, and really appreciate this opportunity just to engage in this dialogue, and appreciate so much our partners at the health department and Dr. Padotti for being here tonight with us to have this dialogue. So the question, let me go back to the question. The question was about athletics. So we have been engaged in a weekly testing protocol with our student athletes. And the reason we entered into that is because we brought them indoors. And our athletes are generally in close proximity to one another when they're competing. And that's especially true with some of our indoor sports. And so we felt it was really important to keep a handle on what was happening, both to understand what was happening as far as outbreaks in those programs, and then individuals making sure that they were safe and able to go home and be safe if they were testing positive, but perhaps asymptomatic at that time. So the good news is that we are getting ready to head back outdoors. Our indoor program, our winter sports program, ends on February 16th. We'll be moving into our spring program. Those are outdoor sports. We know that transmission of the virus is minimized when you're outdoors. We've known that for a long time. And so we've announced our last board meeting, we're actually going to be ending the testing program for our athletes when the spring season begins. So I appreciate that question, but it won't be necessary as we move into the spring sports season.
Great, thank you so much. Next question. Since parents are no longer being contacted when there is direct exposure, the generic email about a positive case in a building hasn't been as useful for some parents. When will this feature of parental notification be phased out? And I feel like Dr. Padotti and Mr. Freeman are both probably able to answer parts of that question.
Absolutely. So I know it can be hard, right, when there's new information and things are changing and it feels like you're kind of hearing some of the same things or new things in similar manners. So we definitely appreciate that. Just like we do for other diseases, part of what we want to do in public health is focus on the situations for COVID now that are more like clusters or outbreaks, right? So those circumstances where we're seeing a group setting that's really seeing increased virus activity, so a particular class or a particular activity that everybody has participated in. And we're going to start to help tailor the investigations and the information that we share from the public health side to those particular circumstances. And the reason, again, is because even though it's not exactly the same as flu, it's similar to flu when we think about what kinds of recommendations we can make. And in those cases where we're seeing those outbreaks and clusters, we want to help people stay aware, stay informed, so that you can think, okay, well, if we're seeing an increase in activity in this particular class or this particular group that my child is a part of, I want to pay close attention. I want to make sure if they're not feeling well, that we're getting tested or staying home when we're sick, and that we're using everything we have, staying up to date on our boosters, washing our hands, using our masks when we need to, using all those tools to help bring that virus activity down. And that's sort of the public health perspective.
And from the school side, so we continue to update our procedures and protocols to align with current guidance. And we work with Dr. Padati's team based on their recommendations. And, we all know that since the end of December, there have been a lot of updates to guidance, and there have been a lot of things to occur. And we know things are moving very fast, and we are trying to we will keep in line with what those are. So we continue to look at adjustments and improvements we can make to align with current guidance, and we will let the community know as we're implementing those changes. But we understand the question, and we look forward to addressing that moving forward.
Absolutely. Thank you all. And this one's back to Dr. Padati. If a maskless child tests positive for COVID, do close contacts have to quarantine?
Yep. So the current public health recommendation is that if you're aware you've had an exposure, you should stay home for 5 days if you're not up to date on those vaccines. But if you're up to date on your COVID vaccines, you should wear a mask when you're around others and immediately isolate or go home if you start to feel sick. And I think this is a good time to sort of emphasize, and I know it's hard when things change, but as things evolve, vdh.virginia.gov is always going to be a good reference for you to look up if you're unsure of sort of the evolution of guidance and the best practice recommendations. It's going to be a reliable source for you on what's evolved over time. And just like we have all along, we're going to continue to share those updates and information together with our school partners as those come through. I do think it's important to note, though, as we move forward with things like at-home tests and a strain of the virus with a much shorter incubation period and the shift in our public health case investigation approach, it is possible that you might not always know if you've had a potential exposure, right? And that's particularly true when virus activity is high in our community, right? If we're out engaging in different kinds of activities, it's possible that we might have had an exposure and we didn't know it. And that's why it is increasingly important for all of us to make use of those strategies like getting vaccinated and staying home when we're sick, because it helps lower the virus's ability to move between us.
Great, thank you so much. And this one's over to Dr. Spence. We have a question about when the school district will open up the option for virtual learning.
Right. So good question. I hope folks who are watching this and folks who have asked that question have gotten the communications asking our parents to express their interest in a virtual learning program as we've begun some of these transitions that we've been talking about tonight. So I can tell you that to date, over 3,000, actually over 3,200 parents have expressed an interest in a virtual option. We cannot accommodate that here locally. However, I can tell you that we have been working closely with our partners at Virtual Virginia. That's the virtual program that we've been using since the beginning of the year for our families who've expressed that interest. And so we think we've identified a potential solution there. And in order to fully understand how that might work, we've got parent information sessions beginning tomorrow, actually, I think, for those parents who expressed interest. And those parents who've expressed that interest are going to be asked to declare through contact with their school counselor whether or not they want to continue to proceed under the limitations of the Virtual Virginia program guidelines and the limitations that really might be in place because a rather quick transition to virtual Virginia for some of our students after their semester's already started. So we're going to explain all of that to those who've expressed an interest so they can make a good decision for them and for their child. This is all going to, these conversations with our school counselors are all going to start on Friday. And our goal is to complete the transfer of students who are able to do so into the virtual Virginia program sometime around February the 14th. Don't want to give it a hard deadline. That's one that we're shooting for, but understand this could take a little bit more time. That's a large number of students to try to accommodate very quickly.
Absolutely. This next question's for you as well. When will the school stop mandating masks on school buses?
Right. So just so everybody knows, that requirement to wear masks on our school buses is part of a federal transportation order. If you've traveled during this time, you know when you go to an airport, you have to have a mask on. If you get on a train, you have to wear a mask. If you get on any kind of buses across the country, you're going to have to wear a mask. That's all part of a federal transportation order. That order remains in effect. And so students do have to continue to wear masks. So the question is, when is that going to stop? And the answer is when the federal mandate's rescinded. We will work very closely, as we've been talking about, with the Virginia Beach Department of Public Health to really assess risk, understand what's going on in our community at that time, and make a determination that we'll communicate with our board and with our community.
Great, thank you. And our next parent asks, if my child is wearing a mask while on the bus to and from school and while in class, why does she sit next to someone who is unmasked? How come I cannot request they sit next to children who are also masked?
Yeah, I appreciate that question. And we've certainly had that from quite a few parents who, understandably, I think have some concerns. Here's what I would say as an educator. We know that the foundation for learning is care and relationships, and developmentally, kids need to be together. We've all talked about that. It's one of the main reasons we've really worked hard as a system to keep our schools open every day so that our kids can be in their classrooms together, learning with each other and learning with their teachers. And I will tell you that if we start separating children out based on who's wearing a mask, it sends the wrong message to kids about that need to be together, and it has the potential to single out children. It has the potential to place our teachers in a very difficult position because we know there's passionate opinions about the wearing of masks on both sides of the question of mask wearing, and we do not want to put our teachers in that position, but also we don't want to introduce negative consequences for our students, and we don't want to put them in the position of having to be in conflict with one another because of external conflict that may be going on in our community around this issue. We need to, in our classrooms, continue to ensure that we have safe, welcoming environments where every single child feels like they belong. That's always our goal in Virginia Beach. We are all about belonging and inclusion, and doing anything differently than what we're currently doing would send the wrong message about our belief in that, and we're just simply not going to do it.
Thank you. I appreciate that. Next question is for Dr. Pedati. What is the threshold and goal of the Virginia Beach Department of Health and the school division? What threshold are they using to stop the use of masks for all K-12 students?
Yeah, so remember, the reason public health is recommending masks for certain situations or timeframes, we do that because we're trying to offer all of the tools that we have available to help lower the risk of virus spreading. So we make those recommendations based on what we're seeing happening in terms of virus activity. And this is another place where, again, flu isn't the same, but it's a really good template. So if you remember, what we do in public health every year for flu is we talk about not necessarily every single flu case or flu number, because we don't track them that way, but we do talk about flu activity. We'll say activity is low, or we'll say activity is high. And the way that we assess that is using a lot of the same pieces that we use for COVID. So we look at things like percent positivity, we look at hospitalization rates, we look at what's going on in different clinics around the area. We look at things like the strains that are circulating. We look at outbreak activities, so where we're seeing different clusters or outbreaks in certain settings. And all of those things can come together to help us understand, okay, we're seeing a little bit of activity or a lot. And then that's what prompts us to say, here are the strategies, the tools that we want to recommend that people can use to help protect themselves and protect their communities. So again, even though they're not the same, flu offers us a lot of those good lessons, and following the trends of COVID-19 is exactly what we're going to continue to do from a public health perspective. So when we see activity increase is when we really want to make sure that we're reminding people of all of those good tools that we can take advantage of to help lower that risk. And when we see activity decrease, we don't need to use those tools as much. So we're going to continue to follow virus activity very closely to help make those recommendations. And just like we always have, if things change, we'll adjust our approach and work very closely with our school colleagues to help make those recommendations and implement those best practices to keep our kids safe.
Great, thank you.
And so when she talks about working with schools, this goes back into the partnership. And as I mentioned earlier, we meet daily to have discussions about what's currently going on in school. So we talk about daily things, but we also talk about the long-term things. And as we assess what our current risk is and what the near-term risk is, and talk about what adjustments in our medications, and we've made many adjustments in our medications during the course of this year to respond to what the current risk is. And that's what we'll continue to do moving forward in close partnership with the Department of Public Health.
Great, and this next one's for you as well, Jack. Why do we send students home for 5 days with one symptom of COVID? What are the nurses' guidelines for when a student is sent home?
And so with the question being sent home for 5 days with one symptom, what happens is they're assessed by the students. If they get assessed by a nurse and sent home, they're sent home with a form that identifies the illness that they were experiencing. And on that form, there are some that are acute onset of one of the following symptoms, and those things are loss or change in sense of smell, sense of taste, uncontrollable cough, shortness of breath, confusion or change in mental status, persistent pain or pressure in the chest, and inability to wake or stay awake. And all those things are clearly not conditions you would want to have a child in school for. And those with that one condition, they'll be sent home. And those are fairly closely associated with COVID-19. There are also some examples of symptoms that if there are two or more of those symptoms that they'll be sent home. And those are things like fever of 100.4 or higher, sore throat, headache, muscle aches, nasal congestion, or runny nose, chills, fatigue, abdominal pain, nausea, vomiting, or diarrhea. So if you have two of those symptoms, the nurse will send the student home with that sheet to say why they've been sent home. And it contains instructions for what to do. And it says your child may return when fever-free for 24 hours without fever-reducing medication and asymptomatic. If your child completes 5 days of isolation, completes a COVID-19 test 48 hours after onset of symptoms, and I'll talk about the COVID test here in just a second, with a negative test result, or you get a physician's evaluation and alternative diagnosis, and then you can return to school. So we have recently received enough BinaxNOW test kits that we're sending students home with those test kits as well. And that BinaxNOW test kit is an at-home monitored test, proctored test, so that you can quickly get results to know whether your student is positive or negative for COVID. And then this sheet then describes what can be, what the appropriate course of action there is. And also on that sheet includes the nurse's name and her contact information so that you can have any connection. So from a standpoint, I think the question was, why do students get sent home for 5 days with one symptom of COVID? Not necessarily true. These forms that get sent home will help support what the decision is of when your child can come back. And that may be as soon as you take the COVID test after 48 hours of onset of symptoms, and your child becomes symptom-free from whatever it was that they were experiencing.
Great, thank you so much. And back to you, Dr. Spence, for this next one. Why does my child have to wear a mask during before and after school activities?
Yeah, so we've talked about Executive Order 2, and Executive Order 2 provides parents the choice to opt their child out of the division's position of mandating the wearing of masks during the school day. And of course, we define the school day as from the time of arrival to the time of dismissal, and all other times fall under what we talk about as before or after school extracurricular programming, not considered part of the school day, which means in this setting, the decision was made to keep masks mandatory unless students were participating in athletics or fine arts programs, which have their own sets of mask guidelines. All of that said, it's a good question. It's been raised a few times, and I do want to note that we are reviewing this. And as with other things, as additional guidance or new information from our health department comes forward, we would consider changes to that as well. But for the time being, that remains in place.
Thank you. And this is another question for you, Dr. Spence. When will you allow parents to have face-to-face meetings with staff members in the school where their children attend, such as parent-teacher conferences?
Yeah, that's great. Let me just say, I really, really recognize how important these meetings are, and I appreciate that question. You know, as a parent myself, let me first say I really have appreciated the Zoom options that we've had to be able to stay in touch with our children's teachers and our counselors. But I absolutely know how important those face-to-face conversations can be. So the good news with that is that those meetings are allowed right now. All we have asked our parents to do is reach out to the school and make an appointment. And so those meetings need to be scheduled. And of course, we've asked all of our visitors to continue to adhere to our mask mandates and our other safety mitigation practices. Otherwise, virtual teleconferences, those remain options as well. So, again, really, they can happen. Just call your school, talk to your child's teacher, talk to your child's counselor. Tell them you'd like to have that meeting, but just recognize when you come in there, you are going to be asked to wear a mask. Adults, including our teachers, remain masked in our buildings.
Yeah, and I think it's kind of fun to mention that we've actually seen an increase in participation in some instances because of the virtual option. So having both is really great, I think, for families from a convenience standpoint.
I think so too. I think it's a great example of one of the ways that things are probably going to evolve as we come out of this pandemic and learn some lessons. I know that that's happening in my field. I'm sure it's happening in other fields where people are saying, hey, we don't necessarily have to have this meeting in person. There are times and great opportunities and reasons to do that, but also times to leverage our technology. I think we can provide parents both of those options. And right now, that's what we're trying to do.
Absolutely. And a big question on, I know, seniors' minds and their families is about graduation ceremonies. How are these new regulations going to affect graduation ceremonies, or will graduation still be at the convention center like they've been in years past? And do we know if they will be with masks or without? And this one is for you, Dr. Spence.
Great. So the best answer I can give you right now is that is to be determined based on venue restrictions. So we, our goal, like we did last year, our intention really is to have the best possible experience for our seniors, and we really intend to have that in person like we were able to do last year. I can signal to you that we don't believe the amphitheater is going to be an option. They are, with concerts and performances back on, they are booked up. However, we've got dates on hold at the Virginia Beach Convention Center, and our intention would be to try to have in-person graduation. But I need to stress this, that is to be determined, because we will be paying attention to VDH guidelines, virus transmission status in our community, and making sure that everything is safe to proceed with that. We place a really great value on providing this optimal experience for our students. And we know what a critical kind of rite of passage this is for our students. And so we're going to do everything we can. Conditions will dictate that. And of course, the question about whether or not masks will be on is going to be in some regards venue driven. So if the venue itself is requiring masking, obviously that's going to be something we would adhere to.
Great, thank you. And the next one is for you as well. In band, the trumpet players are required to wear a mask with a hole cut out of the front when they play. Please educate us on the basis for this policy and how it helps slow the spread of COVID-19.
Right. So that's true. It's probably interesting for some parents who maybe hadn't heard that wearing masks with slits in them for some instrument playing has actually been in place since the beginning of the pandemic for us, since we brought students back. And that was based on recommendations from the National Federation of High School Associations. And so we've had those in place. Since parents can opt their child out of wearing masks in our schools, this also includes mask wearing for those students who play instruments. So folks need to know that. We are, however, going to continue to require belt covers on instruments. All of that said, the question was like, educate us on the basis for where the policy comes from and help slow the spread. And I was wondering, Dr. Padati, if you might just want to talk about the increased risk that's associated with some of that.
Absolutely. So from the scientific and medical standpoint, right, when we think about risk related to an infectious disease, we're taking into account a lot of variables. So there's the characteristics of the disease or the virus itself. How is it spread? We also think about what are the activities that we're engaging in, and are there circumstances where increased breathing or heavy breathing can potentially increase the amount of virus that we could exhale or transmit while we participate in certain activities. So remember, the goal here is not necessarily to make the risk zero. The goal is to think about all of the things that we can do to bring the risk down as low as we can. And so if there are ways that we can help minimize risk for certain activities when we're breathing heavier or more frequently, those are things that, again, taken together, help bring that risk down and reduce the likelihood of the virus moving between us.
Thank you. That's great information. And Dr. Padati, this one's for you as well. Does risk of, and you've hit on this a little bit, but I'm gonna repeat just to get more information out there. Does risk of exposure and transmission increase for masked students and teachers with the presence of unmasked children in the classroom for school?
Yeah, and it's great to keep thinking through the way that we approach risk and the use of our mitigation strategies or the tools that we have in public health, right? And again, when we talk about using all those tools, we're trying to bring down the likelihood that something bad will happen. So we know that we can reduce risk by layering things together. So that means starting on the prevention side with vaccine, and then doing a bunch of other things, right? Screening for our symptoms at home and not going in if we're sick, doing things like frequent hand washing and environmental surface cleaning, using things like distance and space and small groups and cohorting, and of course, using masks. And all of those things together help make it even harder for that virus to go from one of us to the other. So it does mean that if there's somebody who's not wearing a mask and is infected, it could potentially increase the risk in that circumstance of the virus moving from one person to another. And that is exactly why it continues to be so important for all of us to take advantage of all of the public health tools we have available to us to help reduce that spread of the virus, especially when activity is high.
Thank you.
And to add on to that, so as I mentioned earlier, in recognition of that, Virginia Beach City Public Schools, we're also going to be getting KN95 masks for student use and for staff use as well, and they'll be available upon request. And when those are properly worn, they'll offer an increased level of protection for the wearer. And so whenever we have this conversation, I also want to be able to share Dr. Padati showed what happened with community transmission, and that all occurred during a period of time when kids were not in school. It happened during a holiday period where people were in a social environment and their behaviors were a little bit different. And we've talked about the extensive layered mitigation strategy that we use in schools. And we're seeing that since kids are back in school, we're seeing that decreasing trend. So not only in the slide that Dr. Padati showed earlier, we're seeing the corresponding decrease in positive cases within our schools as well. We talk about it every day, and we're seeing that continued downward trend, and we'll continue to monitor that going forward. We know it's only been a couple of weeks since EO2 took effect, but we'll continue to monitor that and make sure that we are understanding what the risk is.
Great, thank you both. Dr. Spence, back to you. Will COVID vaccinations become mandatory for students in the near future? Is there a campaign or anything from Virginia Department of Public Health or Virginia Beach Department of Public Health to make that mandatory?
So I know it from our administration perspective, we don't have any plans. We haven't had any discussions around that. I'm not aware of any plans or any campaigns being developed within the health department around this. And I could say, quite candidly, based on what we're hearing coming out of Richmond, it seems kind of unlikely that that's going to happen. On a personal level, I can tell you it's not my preference to mandate vaccines. And so, but, having said that, I do strongly encourage them where they're appropriate as a key mitigation strategy, like we've talked about over and over again tonight. I think what I would say, and I'm sure that would be nodding heads from our health department, is that parents really need to talk to their child's doctor about that decision. And we would encourage every parent to please think about getting that vaccination for yourself and for your child, and talk to your child's doctor about the appropriateness of that for your child.
Great, thank you. And this is our last question of the evening. Dr. Padati, this is over to you. How can we stop the spread of COVID when we're only testing non-vaccinated athletes? Shouldn't we test all athletes in close contact sports, since we know vaccinated and unvaccinated people can carry and spread the virus?
Yeah, so it's a really important question. And from a public health standpoint, I want to take a step back and just talk again about the goals in public health when we talk about addressing COVID-19. So our goals in public health are to reduce the spread of COVID-19, to protect the people who are most vulnerable among us, so our loved ones who could have bad outcomes, and to make sure that we're keeping our healthcare resources available for all of the reasons that we might need them, right? So keeping that in mind, what we do is we carefully follow virus activity to help us understand the patterns and the things that are going on. Now, thankfully, as you saw with those curves at the beginning, we're seeing that activity come down, but it's something that we need to keep a close eye on, because we know that as long as COVID-19 exists anywhere in the world, it is possible that it could exist here in Virginia Beach. And so what that means is it's important for us to do everything we can to help bring that risk down and to stay informed when we see changes in trends, so that we know what tools we should start to use to help do that. So again, remember, the risk that we see with COVID, thankfully, is not the same today that it was when we first started with this virus. Thankfully, right, we've come a long way in terms of the tools that we have, especially vaccine, which remains the best way that we can protect ourselves and protect other people from having those bad outcomes. So we want to keep in mind, even though it's hard, right, there's some risk inherent in really everything that we do. But there are things that we can do to bring risk of COVID-19 down. So we start with vaccine, and we remember that we can add in things like wearing masks, washing our hands, using distance, and staying home when we're sick, not to make the risk zero, because that's not really possible, but to bring that risk down as much as we possibly can, and to make those risky occasions and encounters less frequent. So together, if we use all of these tools as much as possible, we'll be able to bring that risk down collectively, which means that we can bring that virus activity down and keep our kids healthy and in school where we all want them. And so that's sort of the public health line of thinking on that approach.
And as we've shared a couple of times during the course of this webinar, just as a reminder, that testing program for athletes was only for the winter high risk indoor athletics and conditioning, and that will be concluded at the end of winter athletics and discontinued as we move into spring athletics.
Great, thank you. And I'm going to turn it over to Dr. Spencer for some final words here before we wrap it up for the evening.
Thank you, Ms. Allen. And listen, let me just say thank you again for all of those folks who have joined us tonight for this call. We hope you found this to be helpful. Certainly understand that we remain a resource to you to try to answer these questions. Listen, we know this has been a challenging time. This has been an incredibly interesting and challenging 21 months now, I think. And none of us expected this to go on this long. None of us expected to have to make some of the difficult decisions that we've had to make over time. But here's the thing, we're getting through it. As we saw that curve, the numbers are coming down again. Our kids are in school. Our teachers are doing an amazing job every single day, making sure they have a great learning experience. Our buses are going, our food services is working. And I'm so proud of the team and the effort that we've made to be here for our kids. And that team includes all of our parents, the folks who are on this call, who get up every morning and make sure that their child is ready to come to school and ready to learn, who get on those conversations that you asked about earlier with teachers to make sure that their learning is going well. And I'm just so proud to be here in Virginia Beach, where we're doing this at a really high level and in the midst of incredibly challenging circumstances. We appreciate your support. We appreciate your understanding. We appreciate sometimes your frustration and feel it ourselves and know that we are in this together and we will get through this together. And again, we thank you for joining us tonight. And as the need arises, we will continue to bring these webinars to our community to answer these questions. So look forward to the opportunity to do that if we need to. Dr. Padati, thank you again to your team and the ongoing partnership that we have with the Department of Health and those daily meetings that we have to talk about these issues. You keep us so well informed, and I feel like we're really fortunate to have you in our community. And with that, Natalie, I'll turn it back over to you.
Sounds great. And I would be remiss if I did not say a big thank you also to our sign language interpreters who are here this evening. Thank you, ladies, so much for staying with us for this past hour. We really appreciate your services. And with that, I just want to say thank you so much to our entire community who is here with us tonight, listening and wanting to learn more. As always, this webinar will be available in the next couple of days on our website at vbschools.com with lots of other COVID-19 resources and more. So please visit our website if you have any questions or concerns. Fill out a Let's Talk comment for us, and we're happy to get any feedback from you all. So thank you so much again, and have a great rest of your evening. Stay safe.